Today, 19th November 2025. Greetings and good evening, respected seniors, distinguished faculty members, colleagues, dear participants, and our honored speaker for today, Dr. Eric Borges, sir. On behalf of POPMA, the Practicing Oral Pathologists and Microbiologists Association, I, Dr. Bhuvan Nagpal, the founder president of this association, extend a warm and respectful welcome to all of you on this deeply meaningful and historic occasion. Today, we gather not merely for an academic session but to observe a day that carries profound emotional and professional significance. To celebrate the extraordinary life, legacy, and contributions of Dr. Anita Borges Spam, POPMA has formally decided to commemorate 19th November as National Oral Head and Neck Oncopathology Day every year. This is our humble tribute to the woman who redefined cancer diagnostics in India and shaped generations of pathologists with her teaching, compassion, and scientific brilliance. Today is not just a date on the calendar, it's an emotion, a responsibility, and a legacy we are privileged to uphold. It is now a day when science meets sentiment, when memory becomes mission, and when life continues to inspire us to take forward the path she illuminated. I still remember exactly 1 year ago, around this very time in the evening, I had called Ma'am to convey my birthday wishes. As always, she spoke with warmth and encouragement that made every pathologist feel valued. None of us imagined that within months we would lose the queen of histopathology, the woman who taught India how to look at disease, not just through a microscope, but through a humane lens. India's pathology community lost one of its brightest lights with her passing. Dr. Anita Borges was not only a diagnostic genius and pioneering oncopathologist, but also a beloved teacher and mentor whose compassion touched thousands of lives. As daughter of the eminent cancer surgeon Dr. Ernest Borges, she carried forward his legacy with unmatched brilliance, devotion, and humility. Her life was extraordinary. After completing her medical education at the Topiwala National Medical College and Nair Hospital, Mumbai, and specialist training at Royal Marsden Hospital, London, and Memorial Sloan Kettering Cancer Center, New York, she returned to India not for comfort but for purpose. At Tata Memorial Hospital, she rose to become professor and head of surgical pathology, a position she held till 2004. Later, she became the director of histopathology at SRL Diagnostics Mumbai and at SL Raheja Hospital Mumbai. And then she started a center for oncopathology at Pune, uh, sponsored by Tata Trust. Her influence was global. She was the Dean of the Indian College of Pathologists, Vice President Asia for International Academy of Pathology, India Division, and twice featured in The Pathologist magazine's power list of the most influential pathologists worldwide. Her father had once told her, "A surgeon is dependent on the pathologist to guide his hand." This sentence shaped her life. She would often say, "Work like a pathologist, but think like a surgeon." Teaching, however, was her true heartbeat. She believed firmly that knowledge must travel beyond big cities. To fulfill this mission, she founded the Traveling School of Oncopathology, taking expert teaching to small towns and remote centers without accepting any honorarium. Every rupee she had went straight to support laboratory staff and infrastructure. During the COVID-19 pandemic, she extended her commitment online. Along with Dr. Sumit Gujral, she initiated free bi-weekly virtual pathology sessions for over 5 years, attended by participants not only from India, but from Russia, Myanmar, Vietnam, and Africa. Her lectures often carried beautiful literary titles reflecting her artistic mind. Her final journey was a testimony to her purpose. She passed away in Gorakhpur while attending a pathology teaching program. Her last word, as recorded in the Tata Memorial Hospital obituary, was poignant. Who will take my next class? She left this world doing what she loved the most, teaching. Her diagnostic brilliance was unmatched. Her reports were often considered the final word in cancer diagnosis. She combined encyclopedic knowledge with a rare intuition. Dr. Sanjay Pai recalled that her accuracy was described by peers as perfect. She challenged medical dogma fearlessly, rejecting unproven entities like malignant fibrous histiocytoma long before the world accepted it. Her mantra to trainees was simple yet profound. Listen to the cells, they will tell you the truth. Her expertise spanned all over the body, but majorly her interest was on head and neck pathology, salivary gland tumors, guiding thousands of oncologists across India. Her mastery earned her a prestigious invitation to contribute to the WHO Blue Book of Hematopathology, an honor very rare for a surgical pathologist. What made her truly exceptional, however, was her humility. She often wrote, I don't know, when uncertain, proving that scientific honesty is greater than professional pride. She taught that the description of a pathologist should be such that even a blind person can understand the pathology from your words. I learned this from her personally, and it remains my guiding principle to this day. Behind her formidable intellect was an immensely warm human being, approachable, witty, musical, and deeply compassionate. She funded her own travel to small colleges, sponsored students, upgraded laboratories in under resourced institutions, and encouraged young pathologists to take pride in their work. I first met her in 2013 at a slide seminar at Coorg, and she made me feel like a collaborator, not a student. She was the best mentor one could ever have. Just weeks before her passing, she had graciously agreed to join a Popma study club, a promise that now stands as a final gift to our association. Her life teaches us that excellence lies not only in diagnostic accuracy, but in dedication to humanity. Her philosophy, a pathologist must think like a surgeon and care like a physician, remains a guiding light for our generation and the next. Thank you, Dr. Anita Borges, ma'am. You taught us to see beyond the slide, to listen to the cells, and to understand not just the pathology of disease, but the pathology of life itself. Your light will continue to illuminate our path always. Before we move to the memorial oration, I would like to invite our moderator for today's session, Dr. Nidhi Jadhav ma'am. She is the senior oral pathologist and director at Kanak Diagnostic Center for Oral and Maxillofacial Diseases, to kindly introduce our distinguished guest speaker, Dr. Eric Borges sir, the brother of our beloved Dr. Anita Borges ma'am, and a senior cardiologist and a palliative care expert. Thank you. Over to you, ma'am.
Thank you, sir. Very good evening, everybody. It's a matter of great pride and honor for me to introduce about Eric Borges, sir. Dr. Eric Damien Borges is a senior cardiologist and educator who has also spearheaded palliative care initiatives in Mumbai. He has served as professor of cardiology and senior cardiologist at the Bombay Hospital Institute of Medical Sciences, Mumbai. A graduate of Topiwala National Medical College, Mumbai, Dr. Borges further earned his degree of MD General Medicine and DM Cardiology. Over his decades-long career, beginning with Bombay Hospital in 1980s, he has been recognized with 13 academic prizes and gold medals for his outstanding performances. Sir has done collaborative outreach work in Mauritius and Tanzania through the Bombay Hospital International Network. He serves as honorary chairman of the King George V Memorial Trust in Mumbai. Dr. Borges has an extensive interventional cardiology practice and outreach record wherein he has performed over 30,000 coronary angiographies, including pediatric cases. Sir has conducted more than 7,000 coronary angioplasty procedures with and without stent. As head of KGVM, he has helped establish Sukun Lilia, a 90-bed hospital in Mumbai, which is providing holistic palliative care to frail, elderly, and destitute patients, including those with cancer and chronic cardiac illnesses. Dr. Borges works closely with oncology and pathology experts to deliver compassionate care with multidisciplinary approach. Dr. Borges' academic interests bridge cardiology, hypertension research, and palliative care. He has co-authored the India ABPM study, a large multi-center analysis comparing office ambulatory blood pressure patients. He was the contributor to the Indian Guidelines on Hypertension 3, formulated in 2013 by the Cardiology Society of India. Sir is an advocate for integrating palliative care into cardiovascular medicine with practical frameworks for end-of-life cardiac care. He has peer-reviewed articles which are published on hypertension, cardiovascular risk, and interventional techniques. He is a regular contributor to the profession and patient education platforms through various webinars, CME sessions. Sir has been revered for his teaching and mentorship by generations of DM cardiology students at BHIMS for his mentorship, clinical acumen, and ethical medical practice. Sir is a member of Cardiology Society of India and an advisor to the palliative care panels. Dr. Eric Damian Borges exemplifies the union of clinical excellence, academic mentorship, and humanitarian care. As a senior cardiologist and pioneer of palliative medicine integration in India, his leadership has shaped both cardiac practice and compassionate end of life care. His career stands as a model of service that bridges science and empathy, a true physician educator guided by both intellect and heart. Sir is going to enlighten us today on the topic palliative care in non cancer patients. So, we warmly welcome you, sir, and request you to take over for the session. Over to
Thank you
you,
so
sir.
much. Thank you. Thank you, Dr. Nidhi. It's very kind.
Thank you.
So, do you want me to go ahead now?
Yes, sir. You can start sharing the screen and we
I
can
will.
start with
I
the
will.
session.
I will. I will. Thank you. Can you see my screen?
Yes, sir.
Yes, sir. We can see your screen.
Yes, sir.
Okay. All right. Today is a very difficult day for all of us because we acutely feel the absence of Dr. Anita Borges on this her birthday. I am extremely grateful to the Practicing Oral Pathologists and Microbiologists Association for taking the decision to institute a yearly oration to honor the memory of my beloved sister, Dr. Anita. And also a very big thank you to this association and Dr. Nagpal in particular for inviting me to deliver the first Dr. Anita Borges Memorial Oration. When I received this invitation to deliver the oration, I was humbled and honored by the invitation. On this day, 78 years ago, a star was born, a brilliant meteor that darted across the night sky. Anita Maria Borges, B to her family, AB to her colleagues, the Empress of Pathology to the medical profession, and to me, a beloved sibling who mentored and nurtured me throughout my entire life. She entered this world on the 19th of November, 1947. Anita was, in many ways, a trailblazer. Very early on in her career, she realized that a pathologist had a very unique opportunity to look at the cells and the tissues and to study it with a difference. They could see the biology of cancer and other diseases in a much more profound way than any other doctor could. And it was this realization that came very early on in her career that made her change her way of thinking. And she then implemented this changed way in her teaching practices, which Dr. Nagpal has already talked about. She also believed that the patient was paramount and that the pathologist could contribute very significantly to the clinician and the oncotherapist. And therefore, she advocated that the pathologist should be in the trenches to fight the big C. One of her favorite subjects was oral cancers, which afflict so many Indians. And she devoted her time and energy to this subject and crisscrossed India, teaching the finer nuances of the biology of cancer to pathologists and clinicians. Teaching was her passion. Nothing gave her more pleasure than lighting a lamp in the mind of a student and waiting with expectant, bated breath for the epiphany. She taught with dedication and devotion and showed by example the need for diligence and discipline. I know that generations of students believed her to be the ultimate guru, the Dakshina Murti of pathology. Anita was not only a brilliant scientist, but a multifaceted person who loved in equal measure life and literature, music and melody, history and haute couture, travel and tourism. She lived life to the fullest and on her own terms. Sadly and tragically, we lost this crown jewel on the 18th of September 2025. The world of pathology is a poorer place for having lost a brilliant and wise guru, and the Borges family lost a much loved elder. The half-life of grief is endless. Grief is a catalyst for improvement, not by mourning, not by wearing sackcloth and ashes, but by celebrating and emulating the life of the beloved departed soul. And I say to you, so let it be for Anita. Before I start my presentation, may I request all of you to bow your heads in thanksgiving for the life and work of Anita Maria Borges, that we were so fortunate and privileged to have witnessed at very close quarters. May her immortal soul rest in eternal peace. For this oration, I chose the subject of palliative care for non-cancer illnesses for several reasons. Number one, palliative care and compassion are intimately intertwined, and both were paramount in the heart and soul of Anita. She walked the extra mile and smiled the extra smile to alleviate suffering wherever and whenever she encountered it. Palliative care for cancer is well established in our country, but only a few know that for every one patient with cancer that needs palliative care, there are 10 without cancer that need the same care. This is a tragedy and a travesty, and there are pitifully few centers available throughout the country. This presentation is to spread awareness and kindle the need for palliative care nationwide. Cancer palliative care is generally end of life care or hospice care, but patients without cancer can live meaningful lives for decades. You will be surprised to know that the Sukun Nilaya Palliative Care Center is the first of its kind in the state of Maharashtra. And Anita was so delighted when we decided to start the center. She gave us her blessings and her support. And we will acutely miss her because she had decided and agreed to be the chief of the ethics committee of the Sukun Nilaya Palliative Care Center. So we are really going to miss you, Anita. God bless you for all that you have done for medicine in general. Now, from the title of my slide, you will see that palliative care adds life to years. That's what palliative care is all about, and I will develop this theme as we go along. The history of palliative care is a long one. It goes back 2,500 years to the ancient Greeks. And all of you are aware of the genius of Hippocrates, who many regard to be the father of medicine. In these 6 words, he enunciated 2,500 years ago the essence of palliative care, which reads, care sometimes, treat often, comfort always. Ladies and gentlemen, today, this is still the bedrock upon which the entire edifice of palliative care has been constructed. Nothing happened for 2,000 years. Nothing moved in the palliative care space because there was no palliative care. And palliative care actually started and was introduced in the United Kingdom in 1952 by another wonderful woman, Dame Cicely Saunders. And she introduced this palliative care as hospice care for the treatment of cancer patients who suffered horribly from the ravages of cancer. And in those days, there were very few therapeutic options. And when those therapeutic options were exhausted, these patients were referred to end-of-life care, hospice care, and palliative care. All these terms were used interchangeably. But remember, even in those days, there were so many unfortunate individuals who did not have cancer, but had a variety of other diseases that needed palliative care, but they had no access, or there was no concept of offering palliative care to these unfortunate individuals. It was only 40 years later, sometime in the 1990s, that the northern hemisphere, north of the equator, started taking cognizance of the suffering of these patients who did not have cancer, and little shoots sprung up all over the world where people began to treat these people with compassion and empathy and sympathy and so on. And ultimately, the WHO, the World Health Organization, took cognizance of it. And sometime around 1999, they came up with this definition of palliative care. And if you read that definition, which is up on the screen, you will realize that the WHO said that it was an approach. They did not lay down the law and said you must do this, 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 and this in palliative care. What they said was it is an approach where it is an inclusive approach where you not only include the patient and his suffering, but take care of the sufferings and the travails of the family as well. And many of these patients have life-limiting, life-threatening conditions, which is of chronic nature. And they need not only relief from physical suffering, but also they need relief from other problems, which are psychosocial and other issues that need to be addressed. So this was the start of palliative care in the Northern Hemisphere. The South still had almost nothing in palliative care that was in existence. Now, coming to what we have in India. Okay. Now, in India, what happens is that we have so many patients who need palliative care. It is a tsunami of patients. The statistics are up on the screen. We have 3 million cancer patients at any time who need palliative care. We have a large number of patients, 10 times more patients than who have cancer. And these patients have a variety of diseases: respiratory, cardiac, neurological, kidney, intestinal, etc. We have a large number of pediatric patients who have thalassemias, blood dyscrasias, HIV, neurological disorders, developmental defects, autism, so on and so forth. We have 5.1 million patients with HIV/AIDS, out of which 300,000 of them pass away almost every year. And the list keeps on growing because the longevity of the population keeps on increasing. And as you grow older, the chances of you developing degenerative disorders multiplies, and those also will be added to the list of patients who will be potential palliative care recipients. Now, this is the scenario in India. Now, coming to the place where I live in Mumbai, as many of you may know. And in Mumbai, palliative care for cancer started very early on. It started in 1985, where there's a beautiful, beautiful organization and a facility called Shanti Avedna Sadan, which is exclusively for hospice care, end-of-life care for cancer. And I must say, they do marvelous work. Hats off to them. There are many NGOs which deal with cancer patients and their caregivers. They do a lot of good work in cancer as far as the NGOs are concerned. But there was not a single organization that was doing palliative care work in the non-cancer segment. This was true until Sukun Nilaya was born in 2021. And I hope to be able to showcase some of the work that we do at Sukun Nilaya to help you to understand what palliative care is all about. Now, when we talk of palliative care, I'm sure you have some concept of palliative care. Most of you who are attending this lecture are probably in the pathology space, okay? But I'm sure there are other people also who have joined in. I must say to you that this is a brilliant slide. At the base of that pyramid, you see the foundation on which that pyramid is built. And that foundation is teamwork and partnership. That is the bedrock upon which the pyramid is built. And this pyramid is the essence of palliative care. You have to be honest with your patient and you have to give them hope, not hope of cure, not hope of a great life, but you have to tell them that with palliative care, we can make you better than what you are. We can deal with your suffering, we can deal with your pain, and we are going to be honest with you. In this country, a lot of times you will hear relatives saying, please don't tell the patient what he has because he won't be able to handle it. It will really create a lot of emotional upset for the patient. That, I'm afraid, ladies and gentlemen and colleagues, is very, very far from the truth. If a patient has a serious illness, whether it be cancer or tuberculosis or anything, he or she needs to know what they are suffering from so that they can learn how to deal with it and they can plan their future with that information. So one has to be honest. And what you can do for them is relieve them of any symptoms that are bothering them. You need to give them psychosocial support to help them to handle their life. And by doing that, you are going to improve their quality of life and add life to their days or years or weeks or months that they have left on this earth. So this is the pyramid of palliative care that is so, so very important for all of us to understand. Now we come to the concept of total pain. All of us are familiar with pain. All of us, some of us have suffered pain, some of us have treated pain, some of us know other people who have pain. But when we talk of pain, all of us, majority of us, are talking of physical pain, headaches, stomach ache, chest pain, spine pain, whatever it is. So that is physical pain, okay, which is very common. All of us have it. But we don't think in terms of social pain. We don't think in terms of psychological pain. We don't think in terms of spiritual pain. Okay. And very often these pains are worse than the physical pain. The feeling of guilt, the feeling of helplessness, the feeling that you've been victimized by God. Why has God done this to me? Why has He chosen me to suffer? Okay. How am I going to help my family? What has happened to my place in society? Am I going to be ostracized? Are people going to come and meet me? Are my friends going to abandon me? So these are the issues that torment people, that make people suffer. But unfortunately, very few people address these kinds of pain. So when I'm talking of total pain today, I am talking about the entire gamut of this pain. Okay. And when we deal with palliative care, we take care of all these pains. A normal doctor whom you go to for a headache will treat you for your headache. He'll come to a conclusion and give you whatever medication. But he does not have the time to delve into other kinds of pain that you may have because of the headache or because of the disease that has caused that headache. So, therefore, this is the major difference between going to a person and going to a palliative care specialist. I must emphasize here that every doctor can be a palliative care physician if he delves into the depths of the patient's suffering, into his psychosocial makeup, into his spiritual makeup. He can do a first class, first rate job as a palliative care physician. And therefore, I tell everybody, please treat the patient, not only the disease. Treat the disease. You have to treat the disease. If he's got malaria, you treat the malaria. But don't treat the malaria. You treat Mr. X, Miss Y with the malaria. So you need to treat the patient with the disease and not only the disease per se. This is what palliative care is all about. Now, once you've decided that the patient needs palliative care and he has come to you or he's been referred to you, or in whatever way you are involved as a palliative care physician, you need to evaluate each patient's diagnosis and each patient's symptoms before you start treatment. The common complaint of every patient, and I mean it literally, every patient, is that nobody listens to the patient. Okay? They hear, but they don't listen, right? So you must listen to the patient, figure out what his symptoms are. You need to evaluate those symptoms. You need to find a solution for the symptoms. You need to make certain that whatever solution you have found actually works for him. You need to talk to him or her and say, hey, I started this on you. Are you feeling better? Yes or no? If not, you need to chop and change and take an utmost care to get into every detail that bothers that person. Treat him like he was your brother or sister. Get into details and try to help him the best way possible. After you have good symptom control, you must offer him psychological support. And this is a single most important aspect as far as I am concerned. Okay. The best psychological support that you can give this person is to listen to him. Okay. Most often, nobody talks to them, nobody listens to them. And when you're listening to the patient and the family, you must figure out what exactly the patient and his loved ones need as part of the treatment. For example, he may say, look, I'm not interested in going for any major surgery, major this, major that. Okay, so fine. If there is no other option, that has to be told and explained to the patient. And if he still decides not to go for that surgery, that's his personal decision. He has every right to make that decision. And then he has to be counseled as to what are the consequences. Because remember, every decision, positive or negative, has consequences. And those consequences have to be explained to them, not in brutal terms, but in very factual terms. Very often we are offhandish. आप ये नहीं करोगे तो आप मर जाओगे. No, that's not the way to deal with it. Brutality, shocks, it doesn't work. And therefore, I say to every physician, every practitioner, by all means, tell them the truth, tell them the facts, but do it in a humane way. And being humane is the essence of palliative care. Okay. And once you've understood what the patient really desires out of his treatment, we then need to convey that to the team. Now, what is this team all about? The team consists of so many different individuals, and I'll be discussing that with you as we go along. Okay. By doing this, you foster communication, the spirit of communication. The worst type of treatment that you can give a patient is treatment without communication. So the communication is only through notes on the file. There is no communication, there is no discussion, there is nothing going on. That is the worst kind of communication that you can offer your patients. You need to network. If your patient is coming all the way, traveling many miles to get his palliative care or get his treatment, you need to recognize that travel is a problem. And you need to try and see whether similar facilities are available in the patient's neighborhood. That is our duty, and we should try and do it as much as we can do it. Now, very often, there are advanced directives. Now, what do I mean by advanced directives? Let's say a patient is on dialysis, but he's exploring the opportunity, the possibility of getting a kidney transplant. The kidney transplant is considered to be an advanced directive. The kidney specialist comes into his room, breezes in and says, अभी मेरे ख्याल से आपको transplant करना है, बहुत जरूरी है. Okay? And that ends the conversation. There is nobody there to explain to him the finer points of the transplantation. What are the consequences? What are the costs? What are the downside of it? Everything is presented in a very rosy picture. Then very often that conversation is devoid of reality. And this is where an entire team of patients, of counselors, of physicians, of other people who are involved in palliative care can make a world of a difference. And sometimes, unfortunately, when a patient passes on because of a chronic illness or a complication of a chronic illness, there's a lot of bereavement. And we need to offer the family bereavement support, which I am sorry to say is universally absent in most places where medicine is practiced in this country. If the bereavement support is only from the relatives of the patient and so on, but there is no actual counseling available. There is no other way of getting them psychological support. So this is something that all of us should work on. Now, I'm not going to spend too much time on social support because I'm sure that all of you are aware that there are many, many help groups available for social support. There are a lot of people who in the community offer a helping hand, financial, physical, food banks and so on and so forth, which offer support for people who need it. And I can only say that the more social support that is available, the better it is. Okay. Now, this is the palliative care team, which is crucial to have a successful palliative care center. The physician, of course, is the captain of the team. The nurses, the physical and occupational therapists, the counselors, the speech and swallowing therapists, the nutritionist, and the social worker. Each of these have a stellar role to play. And as we go along, maybe I will refer to these roles on and off as we walk down, and we take this journey in palliative care. Okay. Unfortunately, the there are no such people available in the palliative care space. Okay, there are physicians, yes, but none of them trained in palliative care. There are nurses, yes, but there are no nurses trained in palliative care. And the same thing goes through all the lists that we have out there. There aren't people who are skilled or who have had training in palliative care. Before I proceed further, I'd like to just take a 1 minute to tell you the difference between palliative care and hospice care or end of life care. Okay. If you look at this slide, on the left and the right, you'll see that the first three uh, horizontal bars, there's no difference. It's the same. Okay. Everything is the same. The focus on quality of life is the same, and so on and so forth. But you look at the last two. Palliative care you can start at any time during the trajectory of the illness, anytime. Whether it's earlier on, in the middle of the trajectory, late in the trajectory, you can apply palliative care principles at any time. End of life or hospice care means it will be applied only if the patient has got less than 6 months to live. At that point in time, the person, whether he has cancer or any other disease, okay, it is determined that this patient has run out of therapeutic options and is most likely not going to live more than 6 months. And therefore, only comfort care is given to that patient. There is no attempt made to give him any curative treatment or any treatment that involves any kind of invasive procedures. So you will not put that patient on a ventilator. You will not give him any major blood transfusions, for example, because none of these are going to be meaningful in the management of that particular patient. On the other hand, a patient with palliative care, by all means, he may go on to dialysis, he may be put on a ventilator, and so on and so forth. So this is the basic difference between these two sets of individuals. Now, this is the thing, this is a kind of situation which we see every day in our hospitals. Let me give you an example. A person has come in with a stroke. Okay. He is partially conscious. He's lost his ability to speak. He has lost the use of his right arm and his right lower limb. He can't eat. He's got a nasogastric tube in place. He's unable to control his bladder and bowel. He's got a urinary catheter in place. He has come into the emergency room. He has had emergency CT scans, MRIs, emergency blood work, emergency medications have been given, etc., etc. And the the treatment for as far as the emergency is concerned is over. Okay. What does the hospital say? They say exactly what this doctor is telling the patient. I'm so sorry. I think it's time to take him home. There's nothing much we can do for him. Okay. Now, that is one hell of a tragic statement to make to a patient who has just had a major catastrophic stroke. Okay. There's a lot we can do for such a person. Okay. There is compassion, there is palliative care, and so on and so forth. And today, if we have good palliative care services, there is no need to hear such a terrible pronouncement. No need at all. Okay. And that is where a center like Sukun Nilaya comes in. Okay. Now, these are the common conditions that we see, coming to our center in Mumbai, Sukun Nilaya. 60% of the patients that are referred to us suffer from neurological illnesses, whether it be strokes or dementia or Parkinson's disease or spinal diseases. We have respiratory patients, particularly in the post-COVID era. We saw tons of patients with respiratory illnesses who are quite badly affected by COVID. We have emphysema, chronic obstructive airways, and the list is endless. Patients with liver disease, end-stage liver disease, cirrhosis, all kinds of problems. Then we have cardiac diseases, chronic cardiac failure, cardiac cachexia, chronic renal insufficiency, patients on dialysis, patients with severe neuropathy and so on because of chronic kidney disease, orthopedic injuries, skin diseases, and the list goes on. So all these patients have a lot of suffering, lot of burden, and they come to us for palliative care. And I'm happy to report that many of them go back with a completely different frame of mind, and they are quite happy and comfortable with the care that they receive. Now, I must also emphasize to you that every service in Sukunilaya is completely free. We don't charge one single rupee for anything that we offer the patients. So our inpatient service is completely free, and inpatient includes everything: treatment, medicines, food, everything. Outpatients treatment completely free. Speech and swallow therapy free. Occupational and physiotherapy free. Therapeutic counseling free. Yoga and other recreational activities free. Telephonic follow-up free. Ambulance services free. So everything in Sukunilaya is free. Okay. And of the highest quality. So we do not compromise on quality because the patient doesn't pay for it. Okay. And I will show you as we go along what kind of services we provide them. Now, these are just snapshots showing you what we offer at Sukunilaya. These are just snapshots. As you can see, all the various, we have extraordinary washrooms, which have all been equipped to deal with patients with disability. And you won't find them in even a five-star hotel, these kind of washrooms with all kinds of facilities that we have. The same thing with our inpatient. You'll see more of our inpatient services. Our rehab center is today the best in Bombay. No single private hospital in Bombay can match our rehab center facilities. Okay, it is just amazing that we managed to do that. And thanks to the governor of Maharashtra who gave us a considerable donation, we have state-of-the-art equipment to help our patients, in their rehabilitation. And we have a dedicated team of occupational therapists and physiotherapists who work wonders. We have beautiful gardens and so on. I'm coming to that in a future slide. As far as the facilities are concerned, I showed you some of them and I'll show you more. But today, the thrust that we have started is on education and training initiatives, because we don't have personnel. Today, if I need a palliative care physician, not available because nobody has been trained. They're doctors, yes, but they have no idea about palliative care, okay, and how to approach the patient. It's extremely difficult unless you are trained to be able to follow those palliative care principles. Same thing goes for nurses, and as I said before, and counselors, etc. So we've been very fortunate. The Maharashtra University of Health Sciences, which is the apex university in Maharashtra, has given us the permission to start these courses for doctors and nursing aides. So our first batch will be starting in a month's time. Okay. The SNDT University, which is one of our premier universities, has given us the permission to start courses for nurses, postgraduate course in nursing. The Tata Institute of Social Sciences, which one is of our premier institutions, okay, is collaborating with us to run courses for counseling. So we are marching forward in the educational space, and we know and hope that more such courses will become available, and there will be more personnel available to carry the burden of palliative care forward. Now, as part of this education, if you go to our YouTube site, you go to our Instagram site, we have uploaded training videos on all these various aspects for lay people to learn how to look after their patient if they have such a patient at home. Those patients who are admitted in Sukunilaya, they come with a family caregiver. And during their stay in Sukunilaya, which is anywhere from 15 days to 3 weeks, the family caregiver is trained on how to look after these patients at home. And they are taught how to make the patient's bed, how to prevent bed sores, how to turn the patient in bed, how to feed the patient, how to look after his oral hygiene, how to look after his bladder, his bowel. If he has come with bed sores, how to take care of those bed sores, how to give him the right medicines at the right time, etc., etc. And before that patient is sent home, the caregiver has to pass an exam and satisfy our doctors and our nursing staff that they have learned how to look after this patient and can continue that therapy at home. Okay. And another part of our palliative care setup at Sukudilaya is an adult daycare center. All of you are familiar with child daycare center, or we call them creches, where parents leave young children, for the day, and they are there throughout the day. They are looked after, they are taken care of, they are fed, they are bathed, etc. And in the evening, the parents come back and pick up their children and take them home. Okay. Very often that is necessary because both parents are working, so on and so forth. But in Mumbai, as in the rest of India, there is a loneliness epidemic. Elderly people, people with disabilities, people who are sick, okay, are extremely lonely. And in order to combat that loneliness, okay, we have started this adult daycare center where these people can be brought by their family caregivers, left in our custody, so to speak, where we take care of them. They interact with other people of their own age or younger people. They play games, they entertain themselves. We give them free food, free physiotherapy, free everything. Take care of them. And in the evening, they go back to their homes. Or if they don't have transport, we arrange for transport for them to get back to their residence. Okay. This is the first of its kind in the whole of Mumbai. And it's getting more and more popular, and we're going to have to expand our services. Now, this is something which is quite unique. It is a concept that I saw and experienced firsthand in the United States, in Omaha, Nebraska, where I was visiting a cancer center and I saw this garden of tranquility, where there are beautiful plants, beautiful walkways, beautiful benches to sit on, lovely flowers, lovely atmosphere, and people who are sick, who are ill, they come there and are calmed down. They have a lot of peace in this environment, and it is called a garden of tranquility. So we created a garden like this in Sukunilaya. Sukunilaya, incidentally, we have 7 acres of land. So some of that land we used to create this garden of tranquility, and we called it Pasadi. Pasadi is the Sanskrit word for tranquility. So this garden of tranquility is called Pasadi. All our patients, inpatients and outpatients, spend some time in this garden every day. We have also given them the facility, those of them who are a bit more able-bodied than others, they can do their own gardening. We give them the plants and the tools to do their own little bit of gardening, and they love to come and tend to their plants and look after these plants, which is a great, great boon for them. We have lots of collaborations. I will, it's so many collaborations, too much for me to get into right now. So I'll skip this. And here, I think, is something that you would love to see. This is Sukun Nilaya as we know it. I'm going to play a short film, which is only 4 minutes. Okay. So please bear with me as this film starts. Sorry. एक मिनट बाबा काय
Nestled in the middle of the megalopolis of Mumbai lies the King George V Memorial Trust and Infirmary, a verdant patch in the midst of a concrete jungle. Care and compassion, its trademark. Service to suffering humans, its mission. Sukun Nilaya is one more arm of this service for those in need of palliative care for non-cancer afflictions. The first such center in Mumbai and its surrounding area. Since its inception, Sukun Nilaya has touched the lives of thousands, providing support not just for patients, but also for their dedicated home caregivers who are immersed in every aspect of patient care, so that they can continue when the patient transitions home after an average stay of 3 weeks. Caregiver burnout is a very real and much neglected issue which is prioritized during their stay with us. Our range of services is designed to meet diverse needs: inpatient and outpatient care, rehabilitation programs, clinical counseling, specialized dietary support, speech and swallowing therapy, yoga and other recreational activities. And the best part, all of our services are provided completely free of charge. We also provide assistive devices, testing, and ambulance services free of cost because we believe that everyone deserves quality care without the burden of cost. Since its inception, our center has been supported in its operational expenses by the Sitla Foundation. With its help, Sukun Nilaya launched a unique respiratory rehabilitation program at JJ Hospital, with our doctors, counselors, physiotherapists, and a dietitian to provide holistic care. We obtained permission to expand this facility to 35 beds. Join us on this journey of compassion and care at Sukun Nilaya, where all-pervasive compassion and love meet service and care with dignity. We at Sukun Nilaya dedicate ourselves to the relief of pain and suffering, and we urge the citizens of Mumbai to avail of the all-encompassing facilities at this beautiful and thoughtfully crafted center. Sukun Nilaya, crafted with care and compassion, is a unique, much-needed gift from King George V Memorial Trust to the citizens of our great city. The heady fragrance wafting upwards from this oasis of tranquility will make its way over Mumbai, spreading across the great state of Maharashtra and across our beloved India. Sukun Nilaya, an oasis of tranquility.
Okay, so that was a film on our facility. I hope you enjoyed it. And now I'm going to show you a testimonial from a patient.
सप्लायर थे वो दादर में काम करते थे उनको स्ट्रोक हुआ था उनको जिम में चक्कर आया और हम प्राइवेट हॉस्पिटल में उनको लेकर गए 15 दिन हम प्राइवेट हॉस्पिटल में थे उसके बाद हम केम लेकर गए वहाँ पे 3.25 महीने वो केम में थे वेंटिलेटर पे थे उनका इलाज चल रहा था डिस्चार्ज के लिए मैंने पूछा केडीएस टीम से तो उसमें तानिया मैम थी तानिया मैम ने मुझे सुकून नीलिया करके हॉस्पिटल बताया और उसमें फिजियोथेरेपी सेंटर प्लस नर्सिंग केयर होगा आप वहां पर जाइए आपको वहां पे अच्छा इलाज और ट्रीटमेंट मिलेगा यहाँ पर इतना अच्छा फैसिलिटी है कि एम्बुलेंस वगैरह फ्री में प्रोवाइड कर देते हैं कि आपको पेशेंट को लाना है मुझे केईएम से लाया गया और फ्री ऑफ कॉस्ट लेकर आया गया और मुंबई में इतना बड़ा ये जो सुकून निलिया सेंटर है वो बहुत अच्छा है। यहाँ 2 टाइम चाय मिलता है, सुबह में 8 से अकॉर्डिंग 9 बजे तक आपको नाश्ता मिल जाता है, 12:30 से 1 बजे तक आपको खाना मिल जाएगा। सोने के लिए अच्छा है, गद्दे दिए जाते हैं, पेशेंट के जस्ट बाजू में आप सो सकते हैं पेशेंट को देखते हुए अच्छे से। और आपको नहाने के लिए ठंडा पानी, गर्म पानी, बाथरूम भी क्लीन अच्छा सब प्रोवाइड किया जाता है। पेशेंट को खिलाने के लिए मिक्सी, जार सब कुछ दिया जाता है। आपको पीस कर उन्हें अच्छे से फीड देना चाहिए, ऐसे सिखाया जाता है। मैंने जो यहाँ कुछ सीखा है सब, मैं उनको घर पे जाकर अच्छे से संभाल सकती हूँ और उनकी केयर कर सकती हूँ। जैसे मुझे सिखाया गया डायपर चेंज करना या बिस्तर लगाना, नेबुलाइजर कैसे देते हैं और ड्रेसिंग करना, या उनको और भी आगे कुछ घाव हो गया तो मैं उनका केयर कर सकती हूँ घर पे। मुझे दूसरों की हेल्प की जरूरत नहीं पड़ेगी, मुझे कोई केयर टेकर रखना या कोई नर्स की जरूरत नहीं पड़ेगी। सुकून निलया में मुझे इतना अच्छा से सिखाया गया है। इनकी हेल्प से मैं बहुत कुछ सीख कर अपने हस्बैंड को घर पर अच्छे से टेक कर पाऊंगी।
Okay. Professor. बंद कर रही है। Yes, next slide. Okay, so that was a testimonial, one of many, many testimonials that we have had. There's not enough time to show you more, but it gives you an idea of the kind of patient or patient driven testimonials, which is very, very heartening to hear how happy they are here with Sukun Nilaya. Now we have on the cards programs to expand our facilities. Very shortly, we will be starting a pediatric palliative care facility. And you will be surprised to know that in the whole of India, this will be the second pediatric palliative care facility. And the first one is in Telangana. Okay, and we will be the second one, which is a completely holistic pediatric palliative care center. So we hope and pray that we are successful in this venture as well. And we are in talks with the WHO to be a hub for palliative care in this part of the country. So these are our expansion programs. And we hope and pray to be able to do something with this. Now, I have written a poem for this event, this program that you all have so graciously named after Dr. Anita. And I wrote this poem, and this poem goes like this. A cell under the microscope will reveal whether death is nigh or the body will heal. The pathologist that interrogates the cell will have interesting tales to tell of battles fought with the myeloid horde, some won, some lost in the soul's abode. The eagle eye of the pathologist may see the Langerhans cell typical of TB or the orphan Annie nuclei of thyroid cancer that needs the expertise of a necromancer. The Reed-Sternberg cell of Hodgkin's disease, is it a B cell, or so it does often seem? The pathologist has the final say on how the disease or tumor will play. We need a guru like Anita to demystify and to make pathology as easy as apple pie. Rest in peace, Anita, after a tumultuous life, led with aplomb and with minimal strife. You will be sorely missed by one and all, students, colleagues, patients, and family whom you held in thrall. Adieu, goodbye. And this is the final slide of my presentation. The famous Snoopy and Charlie Brown. Someday we will all die, Snoopy. True, but on other days we will not. And we will be alive and we will be kicking. And if at all one is ill, think of palliative care. Thank you very much for inviting me to speak with you. And may the soul of Anita Borges rest in peace.
Thank you, sir, for such an excellent, inspiring lecture. The poem that you mentioned last indeed was a real exemplification of a pathologist's work and also a real dedication and tribute to ma'am's journey. Thank you, sir. After your lecture, we have actually realized that palliative care we only hear in terms of oral cancer or any cancer patients, but in reality, so many other patients need this so badly, I should say, and this is a part which is very much neglected also. There are situations where the patients are asked for a particular type of treatment and the family gets scared of how to handle with it. And I'm realizing that, this type of facility is so much need of the hour in all the places, I think. Thank you so much, sir. And it was
Thank you.
your lecture has really inspired us. It's not about adding days to life, but adding value to life. Thank you so much, sir. If we have any questions that you want to ask our audience, you can unmute yourself and ask to sir about this topic.
I'm happy to answer any questions.
Or if you would like to interact with sir regarding any doubts about this topic, please feel free to ask.
The participants can unmute themselves and can ask any queries or any doubts to sir. There are a lot of comments in the chat box, Dr. Niti.
Yes, so a lot of appreciation for sir's work are there, no doubt. And his establishment of Sukoon Nilya is no doubt very inspiring, sir. That indicates the selfless work the team is continuing with. Sir, I think there are no questions. We'll move forward. We
Sure.
have a lot of viewers and participants from ma'am's family, and also we have a lot of fortunate, lucky students who ma'am has guided. So, if anybody would like to share your experience or views about your journey with ma'am, please unmute yourself and speak a few words. The stage is open to all. Please share your experiences. We would love to listen to you.
They're saying just a moment. Can you unmute yourself now? I think
Yes, it's unmuted now.
yes.
Eric, I was wondering what is the waiting list to join the palliative care at Sukunilaya?
Well, the waiting list right now, we have 108% occupancy. Okay.
Yeah.
As you can imagine, this facility doesn't exist in most places. So as of today, today's figure is 108% occupancy, and we have a waiting list of about 4 patients wanting to come in. So we are hoping to be able to expand our facility.
Mhm.
And eventually, I think by the end of 2026, we hope to have a total of 75 beds for inpatient services. Okay. We are also collaborating with so many other institutions. For example, the Bombay Port Trust, which is a massive organization. So they have a big hospital but no palliative care. So they want us to take care of their palliative care uh, services. Similarly, the Maharashtra police, they have informed the entire police force in Maharashtra that any patient who needs palliative care should contact us until such time as they are able to set up palliative care services in other places in Maharashtra. So we have a huge issue with not having enough beds. But hopefully the government will respond. And I heard recently that the government of Maharashtra uh, uh, is appointing a task force to start palliative care services in as many hospitals as they can, and they've invited me to be on the task force. So let's see, maybe we can push them to start palliative care services, which are much needed. I cannot tell you how heartening it is to see people who come here and go home. They come with despair and they go back with hope, and they go back so much better than what they came. Quite amazing. Those of you who come to Bombay sometime and would like to visit our center, it's an open invitation. Drop me an email or drop me a WhatsApp or whatever it is. And even if you don't drop me, you just drop in, that's also fine. We'd be happy to show you around facilities and interact with you.
No. Yes, thank you very much for a beautiful lecture. And yes, it's a much needed facility in Bombay. In
Hansa, may I ask you, I know that you are from Sweden, right?
Yeah.
Okay. So tell me, do you have something similar in Sweden? I'm sure you do.
Yes, very well. We do. And it's a beautifully organized. When
Okay.
you there, will come and visit me next time again, and we'll
Oh,
go
yeah, I will. I
places.
will. Thank you for that invitation. Yeah.
Definitely, we'll go and make a study tour to few of these facilities. They are beautiful.
Okay.
We have a specialty in palliative care. Doctors as you specialize, especially in pain management and rehabilitation rehab.
Yeah. So that's exactly what we are creating now in this country.
Hmm.
As I said before, the North has got 3 decades of time
Yes,
ahead of us, but we
yes,
will catch up. Thanks, Hansa.
yeah. Thank you very much.
Hello.
I think, sir, we have Renee ma'am and Rita ma'am, so would like uh, would like to invite them
Sure.
to say a few words.
Hello. Yeah, Jude is going to say something.
Hello, Eric. I'd like to first of all thank you for this most illuminating talk about palliative care and the wonderful work you are doing in this regard. But
Thank you, Jude.
I'd also like to say just now, I've known Anita since my undergraduate years in Nair, and I've grown to know her, and more in my recent years at Raheja, and I cannot tell you how much we miss her. It is a tremendous void, her having left us like this so suddenly. We think of her every day, and I know how devastating it must be for all of you, the family, and I sincerely wish you uh, getting out of this grief as easily as possible, because it must be a very difficult time for all of you and for Natarajan. And I'd like to also say thank you. I only know that she was a phenomenal pathologist and an unforgettable friend. And I can only say, whence cometh such another. Thank you.
Thank you so
I
much,
would
sir.
like to say something. May I?
Yes, sir. Yes, sir. Please.
Okay. I'd like to say something in the form of a vote of thanks or so. Okay. Dr. Anita Borges, on her first birthday in heaven, has arranged with the powers that be to send on her first birthday an avatar of Jesus Christ, Lord Ganesha, Hippocrates, Florence Nightingale, and herself to Earth in the form of this event with her dear brother Eric to educate us all and continue her mission of education in the earthly world. God bless her. May her soul rest in peace. And may you, Eric, continue to blaze new trails, long trails in establishing what is so dear and so missing in our part of the world, at least. Thank you ever so much.
Thank you, sir.
So Lini ma'am had joined, I think.
Yes, yes.
Um, I'll just unmute myself. Yes.
Yes,
Am
ma'am.
I audible?
Yes, ma'am. You're audible.
Right. So I just wanted to reiterate that Anita was very compassionate, and her compassion knew no bounds, and she would, even as a pathologist, call up the patient, call up the patient's relatives, call up the patient's doctors, and like a true detective, she would really get to the bottom of things. I think her role as a pathologist was not confined to the slide, but she went much beyond that. So I think this is a message for all doctors and all pathologists, really, not to confine themselves only to the slide that they see in front of them.
Thank you, ma'am. Dr. Natarajan, sir, would you like to say a few words?
I think he will be unable to say things, so
Okay.
let it be.
Yes, thank you, ma'am. I think we can ask Mandana, ma'am, because she is there. Or anybody who would like to, because we are celebrating ma'am's legacy. So everyone has some or the other memories in their heart, and I think we should share those.
Yes. Good evening, everyone. And I should first uh, share my sympathies with the family and say that Dr. Anita really had a great place in our heart. We, within the oral pathology community, I mean, I know she was a pathologist, but she was really one of us. And it's even now difficult to think of going for another conference and not seeing her there. Uh, the space she has left, it's very difficult to say it cannot be filled. But all I can say is I think she would have wanted us to just keep on doing things and try and do it as best as we can. She was always ready to teach. She was always ready to share, never held back. And I can only hope that any of us would have even a little bit of that in us. And I think that would make a difference, just even a little bit of what she was in us, and that will make a difference. And thank you, everyone. And thank you, Dr. Eric. That was a very interesting, very informative talk. And truly, it's an area that we really need help with. Thank you so much.
Thank you, dear.
Thank you. Dr. Nidhi,
Yes, sir.
yes,
So we'll move forward with the felicitation. So, sir. Sir, please accept this certificate as a token of appreciation and gratitude from our association, Doctor. Thank you so much, sir.
thank you so much, sir.
Thank you. Thank you for inviting me. I'm really humbled and honored. Thank you.
Um, I think, sir, you we presented this honor award to ma'am in our recent conference, and
Right.
it's being received. Now, I request Mandana ma'am to please share this award, though it was already, but sir was not there at that time. So today is the right time we can share. Our conference was there on 5th of October, and we have conferred this honor award to ma'am posthumously, and
How wonderful. Thank you.
Yes, it's an honor to share this, and really, no award is enough, but it's just a small token.
just small tribute to ma'am.
Yes, and it's an honor to share it, and she has a place in our heart. Thank you so much.
Thank you so much, ma'am.
Thank you.
Uh, and now, thank you so much, Dr. Nidhi, for being moderator for today's lecture, and thank you for moderating a majority of our sessions and taking out your valuable time. Um,
Thank you, sir.
so now it's time to say bye, and we'll be meeting for the next session on 29th of November with another session. And meanwhile, if everybody is in a condition they can put on their camera, we can have a group photograph. Um, any more? Thank you so much, everyone, for
Thank you, Dr. Nagpal.
their
Thank you so
gracious
much.
presence. Thank you, Mandana ma'am. Thank you, Pipin sir. Thank you, everyone, for being a part of today's event.
Thank you. Thank you so very much. Really touched and really appreciate. Thank
Thank
you.
you, sir. This is
Thank
the
you.
least we can do, sir. This is the least.
Well, I tell you, it's thank you again. I mean, nothing I can say more than that, right? Thank you.
Yeah.
Thank you for the honor.
Yes. Bye, everyone.
Okay, bye.
Bye.
Bye, sir. Thank you,
Bye.
sir.
Bye.
Thank you so much, Dr. Nidhi.
Okay.
Yeah.
Thank you, sir.
Oh, yeah, that's it.